Hi Courtney, I'm just here to interview you about your communication skills with your nursing profession.
Sure.
How do you use communication in your profession?
Communication is pretty useful in nursing. It's basically the cornerstone, because if you think about nursing at a base level, we're providing a service. And even if you compare it to retail, anything like that, I know they don't want you to, but you need to be able to get your point across to the patients, to the doctors, to your fellow nurses, and you need to do it in a manner that's professional but still non-confrontational. So I suppose just within different areas that I've worked, I've learnt different sorts of communication. Working within emergency, where we were working basically on the same par as doctors. You did a lot of the grunt work and worked up patients first, and then took your case to the doctors. You had to know whether your patient was quite ill, how to actually get that across to your doctor, and actually get them moving in a timely fashion if you had to. So using professional language and being able to emphasise certain points, use the right jargon, and also not offend or not interrupt if they're clearly in something else. So use timing as well. With other nurses, paramount. We do team nursing. I started off and it was independent nursing, and that lasted maybe a year of my training, and then it all went to team nursing. So you have to be able to talk within your partnership, within everyone within the ward or workforce. Need to have a sort of friendly approach. Doesn't matter if they're ENs, RNs, AINs, cleaners, doesn't matter. Just listen to what they have to say. If you think it's right or wrong, you need to be able to word it in a way that won't offend, because you're ultimately spending at least 8 hours a day with these people. You may not get on with them all the time, but you need to be able to get your point across, without offending.
With working with other co-workers, other nurses and other doctors, what difficulties would you find in communication?
Sometimes difficulties arise from different backgrounds. I don't mean ethnical or anything like that. That can be a problem, but what they studied, what areas they've worked in prior. Also, age can be a difference, the different way people communicate these days. One of the biggest things is if it's a very busy ward, really busy workplace, if you don't have time to sit down and air grievances if there are any, look at if there's communication books, look at what avenues you can go through, not just sit down and talk, because often you just don't have the time for it. So find out what ways you can communicate, if there's email, those sorts of things.
In terms with giving patients information about diagnosis and stuff like that, what approach would you give to them?
That's one of our biggest jobs as a nurse, and I often get, I'll say a compliment from patients, you should be a doctor, because our job is to basically sometimes decode what the doctor's just said, because you'll find that the patients go, oh yes doctor, well, can they just tell me, what is my diagnosis? So you have to be able to cut through the scientific jargon that the doctors use and be able to relay it back to a patient. Using just regular, everyday words works best. Approach them as if you'd approach speaking to your family. They're obviously in a situation which is not optimum. If they're coming to a doctor, coming to a hospital, they're usually quite vulnerable, and just sit down, take the time to talk to them, especially if they've got questions. And just explain to them as you go along. Like I find even in the medication rounds, when I used to do those, I used to sit there and you'd find most of these patients, they've got 6, 7 meds, they've got no idea what they're for. Oh, for my ticker, or for my bladder, something like that. Just sit there, and it helps you remember your drugs as well. You just list it off, oh, this is a beta blocker, or this, helps your heart to pump properly, or something like this. So that the patients, then get confidence in you, because they're like, oh, she knows what we're talking about.
effective professional communication would you use?
With communication, it's verbal and non-verbal, and not just, written, non-verbal gestures, postures.
Yeah.
Even if you are angry at a doctor, angry at a nurse, whatever, it's best not to stand there cross-armed, that they say communication's 70% non-verbal and only 30% verbal. So having an open stance, actively listening, eye contact, and just taking the time to hear both sides of the story, or whatever the patient, doctor, admin, anything, whatever they say, and then give time to respond, and vice versa.
In terms of giving poor communication, what would you say would have an effect on the patient?
Being very abrupt, not giving them your attention, like having half of your body out doing something else. Every aspect of nursing is busy, but if you've got to tell them something or relay a message to them, doing medications or doing your busy work or writing notes at the same time, with the patient, isn't it? Yeah. So, what else? Being closed off, no eye contact. It's slightly different when you're dealing with Aboriginal and Torres Strait Islanders because culturally, when you're talking to them, they don't like women absolutely dead staring in the eyes. So occasional eye contact there works better. But if it's important, obviously, just address them as is. But my biggest thing is just give them your full attention. And if there is something else going on that you think might be more important, just say, I need to address something at the moment, I will give you, my full attention. 10, 15, at the end of the shift, whatever.
Would you find with different cultures and being a female, trying to get your point across, they would not listen because obviously they're male. They might think that your opinion's not as superior as another male.
I've had instances in that. I worked bush for a bit, not really bush, but Charters Towers, and we had a higher Aboriginal and Torres Strait Islander community. Lower socioeconomic, lots of alcoholism and mental health problems were involved. And a lot of the times when I was in charge out there, you get people come in, they've still got this opinion that if you're not male, if you're not older, you cannot be in charge. So I'd have patients come in, their child is sick but they don't want to stay overnight, and legally under 16s they've got to have a parent or guardian. And having to get my point across without yelling at them, you cannot go. You will be put in jail. Your child cannot be stayed here without you or a guardian or a family member of some sort. It was like hitting your head up against a brick wall sometimes, and they're like, is there anyone else I can speak to? And it's midnight, and like, not at the moment, tonight I'm in charge. If you have an issue, we have a grievance process, know the complaints process that you've got in whatever workforce, know who to escalate to when it's working hours, basically. Working out there too, I encountered a male who was coming with liver failure and pancreatitis and all sorts of issues from alcohol, and was in immense pain. It is a very painful condition when it's acute, but being abused because I couldn't get the medication to him like that, or attempting to storm off, or I'm going to hit you and things like that. It's about being strong in yourself, but also I had to think about my other nurses because he was threatening them as well, and it's just knowing what your options are, how to diffuse situations. I think there's something we studied in Queensland Health, it was like a mini heaps. It's, of course you can do later on, but it's all about acknowledging, diffusing the situation, hearing their point of view, getting yours across without getting angry. It's all very difficult.
The communication between.
And sometimes you have to dumb it down or liken things to people, like use a situation in your life and then like compared to their situation that they're in. So people want to feel empathy as well.
Yeah.
Yeah, which is a really big thing in nursing.
Yeah. Okay. Is there anything else you'd like to talk about communication-wise?
The biggest thing is if I found, especially in my first year, if I didn't know what I was doing, just ask.
Yeah.
If you're too afraid to ask, there's plenty of avenues to go down. Email your preceptor or your buddy nurse.
Yeah.
If you don't want to ask whoever's in charge, or if you need to do it at a later date because you don't want to do it in front of someone. Try not to be too nervy about doing that or coming across as you're useless, first year, what the hell do you know? Quite frankly, the first years and the second years, third years, they made the best teachers because they've just gone through everything.
Yeah.
They know the importance about having to get the knowledge across, so just speak up, and if you've got problems, spare them, don't let them fester, because you spend a lot of time with your fellow nurses and doctors and cleaning staff, RNs, everyone.
Yeah. Okay, thank you for that,
That's
Courtney.
all right. See, do the job.
I know, it's good.
I remember doing